Hello everybody, welcome to my YouTube channel, Homeopathy Super Sessions by Dr. Jagos. Today we'll be doing the part 2, the second part of the totality of symptoms. Now let us see what are the different types of totality. Well, there are many, like the acute totality, the chronic or the constitutional totality, intercurrent totality, curative totality, non-curative totality, quantitative totality, qualitative totality, sector totality, and pathological totality. So now let us see one by one. In short, the acute totality. It will include the causation, especially the exciting factor. And it will include the location, the sensation, the modalities, and concomitant. In short, the LSMC, and also the remedy relationship. So out here in the acute totality, we have to try and find out the ailments from or the cause, especially the exciting factor. And we have to write the symptoms down in a tabular form, that is the location, sensation, modalities, and concomitants. And sometimes the remedy relationship also will help you to identify the correct medicine, or after giving the acute medicine, what will be the most probable constitutional totality or the constitutional medicine also of the patient. The remedy relationship will tell you. Chronic totality, it will include the disposition of the patient, that is the causation, physical makeup, mental makeup, general symptoms, particular symptoms, and lastly the pathology. So in chronic totality, we go much more into the depth of the patient, and we try and find out what is the disposition of the patient, that is the mental makeup and as well as the physical makeup. So basically, we have to go more into details, more into depth, and find out the chronic totality. Intercurrent totality, it is a totality of the hereditary influences which affect the individual. So out here, whatever hereditary influences or genetic disorders are there in an individual, we have to find that out. So once we find out what is the family history, what are the hereditary influences in the family, then we can identify the fundamental cause. So the fundamental cause of the disease is given great importance to. The genetic predisposition is perceived accurately. It removes the hereditary influence or the obstacle to cure in the form of miasm is removed. So basically, and generally, it is a nosode which is employed. So basically, an intercurrent totality, we have to see what are the hereditary influences, what is the fundamental cause that is from the family history of the patient. And then we have to give generally a nosode is employed, which will remove the obstacle or remove the hereditary influence in the form of the miasm. So basically, we are tackling here the fundamental miasm of the disease. Curative totality, it is a sum of the characteristic symptoms of a case which is curable. So naturally, when the case comes to you, if it is curable, whatever totality we have taken by the means of the characteristic symptoms, they form the curative totality. And the non-curative totality will be, it is a sum of the characteristic symptoms of a case which is not curable. Similarly, if an advanced pathological case comes to you, naturally, you will not be able to cure it. So whatever totality we are taking, it is the non-curative totality. Now, quantitative totality. All the symptoms of a case are taken into consideration. So quantitative, it deals with the quantity, it deals with the number. So whatever symptoms are there, X, Y, Z, or 1 to 10, or whatever symptoms are there, all of them are taken into consideration. It occurs in advanced pathological case where the susceptibility is poor and the patient does not express characteristic symptoms. So in an advanced pathological case where the susceptibility is very poor, it is weak, it is enfeebled, naturally, the patient will not express characteristic symptoms. Only common symptoms of the disease will be expressed. So you have no other choice than to take the common symptoms and prescribe. So therefore, it helps to form the diagnosis of the disease also. So by taking into consideration the common symptoms, naturally, we will be able to diagnose the case. So the quantitative totality basically deals with the case diagnosis. It has no importance in identifying the correct remedy, but in certain instances where you have no other choice, when the susceptibility has been suppressed, or it is hampered with, or it is very enfeebled, then the patient will express only common symptoms. So we have no other choice, take the common symptoms and prescribe. Then what will happen? The susceptibility, which is enfeebled, will get slightly stronger, or it will get raised. Once it gets stronger, then it will exhibit the PQRS symptoms. So again, retake the case and try and find out the next best remedy. Now, qualitative totality. It's the aggregate of the character symptoms of the case. So qualitative meaning what? We have to deal with the quality of the symptoms and not the quantity. So in qualitative totality, we have to take the sum of the PQRS or the characteristic symptoms. It is seen in functional disturbances or where the path will not advance and is reversible. So when will we see this qualitative totality? Generally, we see it in reversible conditions or in conditions which are functional, and the pathology is just in the beginning stage, it is not advanced, or it is a borderline case between reversibility and irreversibility. You are getting both common and PQRS symptoms. Then in this manner, whatever totality you take, it is known as the qualitative totality, and the pathology is generally reversible. And for the qualitative totality, it is identified by the disposition of the patient. So the points which are included in disposition are the causation, general aggravation and amelioration, general sensation, complaints and particulars, mental states, characteristic particulars, or the keynotes. So the disposition we have to see, we take the cause into consideration, the mental state as well as the physical state, but all of them should be, all the symptoms taken should be characteristic in nature. Now the sector totality. Here, the presenting complaint or the chief complaints are taken into consideration. So what forms the sector totality? Whatever symptoms the patient has come to get relief to the physician, that is the sector totality. That is nothing but the chief complaint or the presenting complaints of the patient. So from that presenting complaint or chief complaint, we have to evaluate only those symptoms which are characteristic in nature, and then form the totality from the location, system, or the organ which has been involved. So we have to see in the sector totality what sector is there, or what part, what location, what system, or what organ is involved, and what are the characteristic symptoms of that part, or of that organ, or of that location. So that is known as the sector totality. So we have to give a sector remedy only covering that particular totality. Then the pathological totality. Here the pathology is taken into consideration due to lack of characteristic symptoms. So many a times we do get cases which have advanced pathology and the susceptibility is poor. In such an instance, there'll be lack of, or there'll be very few, or rather only one or two character symptoms, and all the others will be common symptoms, or all the others will be the pathological symptoms. Used when there is an end organ damage, or when the pathology is irreversible, or advanced pathology where reversibility is not possible. So out here, the pathology has advanced, the organ has been damaged to a considerable extent, or it is irreversible pathology and reversibility is not at all possible. Susceptibility is suppressed or weakened due to modern medication, and the patient is overloaded with the modern medication, as a result of which the susceptibility is weakened, it is feeble, it is suppressed, and it is not strong enough to throw out the characteristic symptoms. Here, Dr. C.M. Boger used the method of prescribing. So Dr. C.M. Boger said that every time you cannot go according to a Kentian method by taking the mentals, the physical generals, the physical particulars, and lastly the pathology. Dr. Boger says that what happens in a case where the pathology is advanced, in those cases, you do not get characteristic symptoms, you only get the common symptoms. And he also says that the mental state is difficult to fathom, especially in the hands of the beginners. So even experienced doctors sometimes find it difficult to identify the mental disposition of the patient. So therefore, Dr. Boger says that in such cases, you have to take the pathological generals. So he's given examples of pathological generals like calculi, desquamation, moles, nevi, fungi, etc. So pathological totality, you have to take when there is an advanced pathology and only the common symptoms are there. Probably you may get only 1 or 2 characteristic symptoms. So that's all. Hope you enjoyed this video. If so, please give it a thumbs up. Thank you for your patient hearing.